lodging and forcing the object out. Okay, guys, we're going to go into foreign body airway obstructions now. I want you guys to understand that a foreign body airway obstruction, the definition of the foreign body airway obstruction is a complete obstruction, which means your patient can't talk, they can't cough, and they're not getting any air into their lungs. We're also going to talk about partial obstructions. Partial obstructions, the patient can still cough. They might even be able to talk still. Okay, so that is something that you guys can use to kind of reassure your patients when you guys get called out for somebody that's choking. If your patient is coughing, they technically have an airway. Okay, now that being said, we don't want our patients talking too much because we don't want that partial obstruction to become a complete obstruction. But we do want to use a lot of therapeutic communications with our patients. We do want to make sure that the patient understands what we are doing, right? Specifically, coming up from behind them and giving them that big bear hug before we actually start doing a Heimlich. We want to make sure that they understand the procedure and talk to them while we are doing all of this stuff, okay? If we do not clear this, they will die. Period. Okay, this is a true life-threatening emergency. Okay, we're going to talk about this later on or throughout this lecture. Excuse me. So for adults, this usually happens while eating. Okay, this usually happens while you are sitting there eating that big old juicy ribeye, right? And maybe you guys haven't had that big old juicy ribeye in a while, right? So you basically cut that thing in half and try to shovel that thing down your throat, and all of a sudden you start choking. Or some adults are famous for talking with a whole bunch of food in their mouth, right? And as soon as they breathe in, they start to choke, okay? Kids, on the other hand, basically the younger they are, the more susceptible they are to foreign body airway obstructions, because remember, children explore their environment by putting things in their mouth, okay? And when we're talking about anatomical differences between an adult and a child, it is astronomical by the size of their airway. Most of you guys right now, gentlemen, your airways, your trachea is just either as big or just smaller than about a 50-cent piece, okay? Ladies, you're anywhere in between a quarter and a 50-cent piece, okay? When we're talking about children, and let's say I'm going to go children under the age of, if I had to put a label, let's say under the age of 10, okay? They're about the size of a dime, okay? And then when we're talking about neonates, brand spanking new bundles of joy, right? When they come out, their airway is about the size of a Bic pen cap, okay? Extremely small. All right, big difference. Okay, so remember that really when it comes down to it, most of your calls for foreign body airway obstructions are going to be for kiddos or adult males. Okay, females, you guys really don't choke too much, but males, it seems, and we're going to talk about this more specifically when we get into trauma. Any male between the ages of 16 and like 32 are, for lack of a better term, mentally handicapped during those times. We are basically, and I hate the word, but I'm going to use it, we are basically retarded. We try to do things to, especially during that time, to impress the opposite sex. And we can really do some damage by trying to impress them. We're going to talk about that more later when we get specifically into trauma with our 16 to 32-year-old males, okay? But just so you know, adults, it's usually while they're eating, and children, it could be at any time because they explore the world with their mouths. Okay, as a reminder, please remember that the number one occluder of most airways is the tongue. It is very large. It is very slippery. And especially in our unconscious patients, it is very hard to get control of it, specifically as EMTs. We have a lot of tools in our tool chest in order to control the tongue, and you guys have already learned about a couple. Either the NPA or the OPA, right? Depending if the patient has a gag reflex or not, okay? The problem with foreign body airway obstructions is that even if we are able to get these out of our patients, the lining of our pharynx, our mucosal lining, is extremely sensitive to that kind of stuff. So even though we got this half a cow out of our patients' mouths from them trying to swallow it all at one piece, we could have irritated the lining of our mucosa. And let me rephrase that. It's not could have. We did irritate the lining of our mucosa. And that can start swelling as well, which can actually cause us to start choking again. So even though you guys were at Red Lobster off duty and you guys saw somebody choking and you guys decided to act, good for you, and you guys performed the Heimlich and you got that 6-inch crab leg out of that dude's throat, he probably should still be assessed, at a minimum, assessed by a paramedic. So make sure that you guys are still activating 911 if you guys are off duty. If you guys are on duty, you guys will more than likely probably be trying to convince that patient to go to the hospital, or at a bare minimum to not eat for a little bit, okay? Because we don't want that lining of the actual or the swelling of the actual tissue to become a problem again for a patient, where it can actually slip them back into another choking episode. Okay, so early recognition is crucial. We all know the universal sign for choking, which somebody puts their hands around their throats. I say that about my White Sox every single year. So we all know the universal sign for choking. If patients can still exchange air, right, if they are able to cough, they are still able to breathe, and you need to reassure the patient of that. Obviously, you guys are going to get pretty anxious when you guys start choking, okay? And that can definitely make things worse. We need to calm our patients down. We need to tell them, look, sir or ma'am, right, if you are able to cough, you have an airway, all right? Let's still provide this patient with oxygen just in case that partial obstruction becomes a full obstruction. That way we have at least perfused as much as possible before we might have to start CPR on this patient, okay? So let's try to get them on some supplemental oxygen. Let's get all that respiration and perfusion, try to work that oxygen around the actual partial occlusion. Let's make sure that we are not talking to our patients, or I shouldn't say not talking to our patients. Let's say we are not asking our patients questions that might be very elaborate. This is going to be a yes or no scenario, because we don't want that partial obstruction to become a full obstruction because they're talking to us, right? The other thing, and this sounds kind of weird, but you guys got to remember this as now EMTs, is we do not want them trying to swallow water, okay? Or any kind of drink, right? Whether it's their nightcap vodka, right? Or their iced tea. It doesn't matter. If they have a partial obstruction, we want them to cough that out before we offer them something to drink. And that's kind of hard to explain to your patients, but make sure that they're not trying to put anything else in their mouth while they have a partial obstruction of their airway. Okay, so again, if they are able to cough, they have an airway, all right? Make sure that we are able to give them some oxygen. We want to treat this immediately. We don't want to wait, okay? Let's at least get them in the back of the ambulance and maybe start rolling to the hospital. Let's not do everything on scene, okay? Let's get them in the back of the ambulance. Let's get them into our environment, all right? That's where we're most comfortable. As EMTs, we're most comfortable in the back of that ambulance, okay? We got a lot of tools back there that we can use to help our patients out. So let's take them to the tools. I'm going to say this again to you guys, okay? I'm not telling you guys what to do on whether to stop at car accidents or stop at, not help somebody that's choking. But remember, we are like car mechanics, okay? We are 100% useless most of the time without our tools. Let's take the patient to our tools. And if you are off duty, let's get the tools to us. You make sure that you are calling 911. And when it comes down to it, you guys will get training on this, specifically on how to treat foreign body airway obstructions when you guys take your Health 1001 class. Some of you guys have already taken Health 1001, so good for you. You guys need to understand that when somebody is doing this and you guys are off duty, you don't say, hey, somebody call 911, because nobody's going to do it. Okay? Point to somebody. Call them out. You call 911. You stay here and you call 911 so I know that I have backup coming. Okay? And then start working everything, right? Make sure that you guys are treating immediately, and don't let the fact that your patient is possibly changing colors, if this has become a complete obstruction, don't let that distract you. Keep performing the Heimlich as best as you can until this patient goes unresponsive. As soon as this patient goes unresponsive, let's try to assist them to the ground. Don't just let them flop to the ground, right? Let's assist them to the ground. Let's do a head tilt chin lift so we know that we are opening up. We have a good straight airway, right? And then we're going to start CPR. And while we're doing CPR, while we are doing CPR and we're waiting for help to arrive, make sure that you guys are staring in the airway to see if you can see whatever object is in their throat start popping out, okay? And when you guys do see this object, this is the only time when you guys are allowed to actually put your finger in there to scoop out the object. Okay? Remember, we talked about putting fingers in people's mouths. Be very careful about putting fingers in people's mouths. Okay? But if you are off duty and you guys are performing the Heimlich on somebody, and you guys witness them go unresponsive, and you guys have laid them down, and you guys have performed the head tilt chin lift to make sure that you guys have a straight airway, and you guys are performing CPR and staring at the airway, and you guys see this half a cow come out of their throat, sweep it out. Put your finger in there and get it out of there, okay? Don't be afraid at that point to put your fingers in somebody's mouths. All right, there it is. The universal sign for choking, okay? Whenever we have that severe airway obstruction or we have a 100% occlusion, your patient will not be able to talk to you. Your patient will not be breathing. Your patient will not be coughing. Okay? Again, don't let the fact that they are changing 1,000 different shades of blue into purple distract you. Do what you have to do. You keep doing that Heimlich as best as you can. Let's talk about the Heimlich here real quick. Okay, there's a saying out there that says that if you're not cracking ribs when you're doing the Heimlich, you are doing it incorrectly. I don't know how I feel about that as a paramedic, but I'll tell you I have performed the Heimlich on a couple people in my lifetime, and I have cracked their ribs by performing the Heimlich. Okay, really they've been the floating ribs on the bottom, but remember that you guys are pushing in and up. And when you guys are doing the Heimlich, the purpose of that is you guys are trying to get that diaphragm, right, to basically hyperextend itself, okay? You guys are using that Heimlich maneuver to push the diaphragm up into the lungs so that whatever air they do have in their lungs, we're trying to expel that air up back through the lungs into the trachea in order to remove the object, right? So yeah, I kind of agree, even as a paramedic, that if you're not cracking ribs on doing the Heimlich, you are doing it wrong. And let's talk about people as a species. Let's talk about human beings as a species real quick. Here is the famous call, okay? Especially for adults, okay? Adults are huge at doing this. When you guys are choking, and I want you to put yourselves in this situation. You guys are choking on something, okay? You guys start getting a little anxious, right? You guys start dumping adrenaline. You guys start to stimulate your sympathetic nervous system, your flight or fight, right? Your brain sends a signal to the lungs, and basically your brain saying to the lungs like, hey, what the hell is going on? Why are you guys not working? And the lungs kind of say to the brain, well, you're not giving us oxygen. You're not, I don't have any kind of respiratory rate, depth, and effort. Maybe you should go back up there and slap around the medulla and the pons, right? So the brain gets this signal from the lungs, and the brain says, okay, you're not going to work, so now I'm going to pick on the heart. And it goes and sends a signal down to the heart, and it says, hey, for whatever reason, these lungs aren't working for me, so I need you to beat faster. Okay? And I'm going to have you to beat faster in order to make sure that we get as much oxygen to all the tissues, because I'm starting to get pissed off up here because for whatever reason, the lungs aren't listening to me because I'm not getting any oxygen, right? So the poor heart, it's like mommy and daddy are fighting and the heart's taking the grunt of it. So the heart naturally speeds up. It starts beating faster, it starts beating faster, it starts beating faster. And because it starts beating faster, it's using what? Very good. It's using up energy, right? It's using up energy. And after a while, that energy is going to be depleted and the heart is going to start pumping, or is going to stop pumping. Okay? And now we have a situation where the patient is just coded. You guys got to start CPR. Okay? So, what do people normally do as a species? Now, remember, we were animals at one point. What does a wounded animal do? What does a wounded animal do when it is stuck in a situation, right? A wounded animal is going to get up and run away. It's the body's natural response. So here's the call I'm going to give you guys. Let's say you guys are going to Texas Land Cattle, and you guys are responding to a 50-ish-year-old male who is completely 100% unresponsive. They can't feel a pulse in the bathroom, right? I guarantee you, most than 90% of the time, at some point, this gentleman was choking. And he was with his buddies. They were having a good time. Maybe they were having a good family reunion thing or something like that. And all of a sudden, he starts choking. And his sympathetic nervous system kicks in. He starts getting embarrassed because he's choking. So he gets up and walks to the bathroom, right? He gets up and walks away from all the other human beings. He goes and he sits down in the stall and he's trying to get this foreign body airway obstruction out, and it doesn't work. And all of a sudden the family's like, hey, where did Johnny go? Right? Well, unfortunately, Johnny's dead in the bathroom because they didn't know Johnny got up and left, and he's been away probably for about 45 minutes now. Okay? It happens all the time, guys. It happens more often than you think, okay? So here's the point of this story, all right, is that when you guys get out into the field and you guys become licensed basics and you guys join a affiliated service, please make sure that you guys become advocates for your community, okay? Most of the higher-end restaurants, I shouldn't say higher-end, most restaurants, period, okay? Most restaurants, period, their staff is trained on how to perform the Heimlich. Okay? They're trained in CPR. All right? They basically take that Health 1001 class that you guys take. And guess who teaches them? You do. Basics do. It is a sweet overtime gig. You guys got to get a little experience behind your back before you guys are able to sign up for these shifts. But we send you guys out there as basics in order to train the community on how to perform CPR and get rid of foreign body airway obstructions via the Heimlich maneuver. I'm going to tell you something right now. What warms my little heart is when I show up on scene and there is a layperson, somebody that has no experience in medicine whatsoever, and they are doing CPR on somebody. And not only that, they're doing CPR correctly, right? And then we come in and we take over, and me as a medic, myself as a medic, if I show up and they're not tired, I will let that person continue CPR until they get too tired in order for one of my partners to take over. I love that. I love that. And that's because you guys, as EMT basics, go out there and train CPR classes for the lay public. Okay? It makes me happy. And I'll tell you what, I'm going to give props where props are due. When I get that pulse back, okay, because that gentleman or that lady decided to jump in because they happen to have taken a CPR class and they jumped in to save somebody else's life and they're doing that CPR appropriately, right? I will have no problem. As soon as I get pulses back on that patient, I throw that patient on my gurney, I will call them out. And I said, ma'am or sir, you are the reason why we have pulses back in this patient. And it makes them feel all warm and giddy inside, right? And it's the truth. Okay? And it's the truth. Early recognition is the key. Get out there, start training the lay people, get out there and be advocates for community once you guys get licensed and affiliated with the service. Now, unfortunately, that's not always the case. Okay, there are some people out there that are trained in CPR that wouldn't touch that patient with a 10-foot pole, right? With all the litigation we have in our society nowadays, the possibilities of getting sued, the fact that the Good Samaritan law, right, has been pushed to its limits, and we are now starting to see it really kind of disappear from our society. Okay. And it's a damn shame. I'm gonna throw it out there, right? Where you have somebody that is trained in order to do something that can help save somebody's life, and they are too scared to do it. At the minimum, hopefully they call 911. Okay? But you guys know how it is nowadays, right? People see this person fall or collapse or something like that, and they whip out their phones and they start videotaping. They don't call 911. They don't care, or they're afraid, right? If this goes untreated, guys, the patient will die. Okay? And from my understanding, based on the pathophys that I know, it is not a pleasant death. Okay? It's basically you guys drowning in your own sputum. And from my understanding, and even with the scientific research, drowning is one of the most painful ways to die, right after exsanguination, right? Where all the blood is let loose from your body. Apparently that is the most painful way to die. But again, we all got to die somehow, right? If your patient goes untreated, they will die. Period. Okay? We are not in that business. Okay? We're not technically in the business of saving lives. All right? We are in the business of patient comfort. We are in the business of sustaining life. Okay? There are some patients where I have ran this code, right? That they have been choking on something, and we had negative outcomes, right? But at least, and we're going to talk about this more when we actually get into like the actual emergencies that we run. At least myself as a paramedic, I was able to sustain them long enough for them to say goodbye to their family members. Right? And if I could do that on any given day, that makes me happy. That's what makes this job worth it. Okay? Now, don't get me wrong. I love running that really sick patient and seeing them walk out of the hospital 2 days later. Right? Awesome. Okay? I can honestly say I've saved a life. All right? And it feels really good. Right? Because you guys are going through all this training. You guys are going through this hellacious class where I am dislocating your guys' jaw. I'm spreading it opening, and I am vomiting information down your gullet, trying to get you guys to keep swallowing. Right? That's what this class is all about. Okay? There's no way you guys are going to retain every single thing that I say. Okay? There's going to be some stuff that we talk about that's going to make absolutely no sense to you guys. until you guys actually get out in the field. I've told you guys this before, and I'm going to keep saying it throughout the semester. You're going to get sick of me saying it. Okay? Your training does not start until you guys are hired on with an ambulance service. They throw you the keys. They tell you, hey, have a nice day. Don't kill nobody. Okay? And they let you out into the wild. Right? That's when your training starts. Okay? And then all of a sudden, you guys are going to rethink about, oh, man, you know, you guys are going to be scared. You guys are going to be nervous. You guys are going to be that little puppy dog with its tail between the legs, shivering in the corner, like those little damn chihuahuas, right? They're always constantly shivering. That's going to be you for at least probably the first year of your guys' existence as EMTs, right? But then all of a sudden you start getting confidence and be like, oh, hey, that's what he was talking about. Right? I remember this now. I remember this now. I remember how to do this. I know I can put this piece of equipment on this patient. And it all just starts to make sense. Okay? It all just starts to make sense. Stick with me. I know this is a lot of information. I promise you guys we're going to get through it. Okay? Okay, guys, so for those of you guys keeping up, this is slide 7 of 7 for the foreign body airway obstruction. Don't freak out. I did not skip a slide. This is slide 7 of 7. So we want to make sure that if this patient does go unresponsive, we are still doing the head tilt chin lift technique. We want a straight airway. We want to try to get that windpipe as straight as possible while I am thumping on this person's chest doing CPR in order to dislodge this obstruction. Excuse me. If it is large, okay, and we can see half this cow coming up the back of the gullet of this patient's throat, we want to take our gloved hand, if possible, and we want to use our index finger. Guys, this is a National Registry test question, okay? A lot of people like to use their pinky. Okay, first of all, your pinky's not long enough. Second off, you don't have as much dexterity in your pinky as you do in your index finger. Okay, your index finger is much stronger than your pinky. The other thing is that your pinky is kind of small, so that if you are able to get your pinky all the way down to the back of somebody's throat, more than likely you're not going to be able to scoop that piece of foreign body obstruction out, and you're going to push it down even further. Okay, so we want to use our big old index finger, right? We want to get our big old index finger all the way down there, as far back as we can do, and kind of come up underneath that airway obstruction and pull it out. Okay, make sure you guys are using your index finger, not your pinky. Okay, however, it is very rare. I will say this: I've seen it. I've ran this call. Okay, but it is very rare that you guys are going to get to the point where you guys need to do CPR on somebody that's choking. All right, the Heimlich maneuver, also known as abdominal thrusts, right, is very effective, especially if it's done right. Now, that being said, there are some very big people in our society, okay, and there might be that person that you guys are not able to get your arms around, okay. They might be very fluffy or girthy, however you guys want to put it. That should not stop you from trying to perform the Heimlich. Okay? Get behind them. All right? Find your landmarks, and you guys will get your landmarks in Health 1001. Get behind them. Find your landmarks. Try to push in as hard as you can and in and up as hard as you can. Okay? Even if you guys are literally just kind of on the side of this patient, it's better than nothing. Okay? Try to do your best. Make sure you guys, if you are off duty, that you guys are calling for backup. Okay? Make sure you guys are pointing at somebody. Hey, you, sir, you call 911. Don't just make an announcement, hey, somebody call 911. Don't do that. They're not going to do it. They are not going to do it. Okay? They're not going to do it. Call somebody out. Point to somebody. You, ma'am, please call 911. Let them know that they have an off-duty EMT. We have an active choking situation, and give them the address of where we're at. And stay here so I can hear you say it, right? unfortunately, the people are like sheep. Okay, they're not going to do anything unless they are told to do something. So tell somebody to do something. Okay, it's amazing how you call somebody out, how they actually kind of start paying attention to you. All right, but please make sure that you guys get help. Look, I said this before too. We are like car mechanics. Okay. We can do some stuff with our hands, but we are about 90% useless if we do not have our tools. Okay? Get the tools to your location. All right? Get the tools to your location. Okay, guys, that was a long presentation. You guys have about 6 different videos, recordings, about 20 minutes apiece. This is the way I wanted to do your A&P, but unfortunately it didn't turn out that way. So you guys will see that I broke these down to categories for you guys, so you guys can listen to these whenever you need to. This was a long lecture. This was a lot of information, so please make sure that you guys listen to all these and go back and listen to the ones that really don't make sense. If they don't make sense, make sure you guys are reading the material in your book. And of course, as always, if you guys have any questions whatsoever, please make sure that you guys get with me, okay, so that I can clarify some stuff for you. I think this is going to make a lot more sense once we actually are able to get our hands on the equipment. And we'll kind of discuss this stuff again once you guys are scheduled to go pick up your Airway equipment from the school. So, as always, thanks for putting up with me and listening to the lecture. I did skip a couple of slides at the end on dental appliances and facial bleeding. I think the big take home from this is make sure that we never ever withhold oxygen from anybody who needs it. And this has to be moved up to one of the priority items in your treatment, okay? Making sure that your airway is open and patent. We've discussed a couple different techniques on how to do that. We've talked about supplemental oxygen and oxygen therapy in general. We've talked about the tools that you guys will use in order to provide oxygen to your patients. And we've talked about foreign body airway obstructions and how to deal with that. So again, please email me if you guys have any questions. Thanks.